Hey friends, Dr. Babb here. Last week I started a new video grouping called Looking Beyond the Labs, and we focused on thyroid disease, and I decided to make that a two-part video because I feel it's such an important topic that I really wanted to be able to give it the time that it deserves and not give you a 30 or 40-minute video. So last time, we looked at kind of the basics behind how the thyroid functions, what it does, and today we're going to focus on some very specific thyroid disorders. Now, a lot of you had actually sent in questions, and so I'm going to do my best to address all of those, but as always, if there's something I don't get to or you find that you have something that you'd really like to know otherwise, make sure that you send me a question in the link below or on my Facebook page, Dr. Babb. Otherwise, I hope that you'll join me tonight on Looking Beyond the Labs Part 2 on thyroid disease. So the three different specific thyroid disorders I wanted to talk about are as follows. So the first and probably the most common that we see is what's called Hashimoto's thyroiditis. That's basically a form of an autoimmune disorder that starts out in more of a hyperthyroid state but then transitions to a hypothyroid state. After that, I'll talk a little bit about thyroid replacement status post-thyroidectomy, or the surgical removal of the thyroid, and then we'll finish up with Graves' disease. Graves' disease is the eponym of the disease hyperthyroid, and once again, it's another autoimmune disorder as well. It just affects things in a very different way. So we'll start off with Hashimoto's and go from there. Now, thyroid peroxidase is a hormone that is found within your thyroid and basically helps in the formation of thyroglobulin. And thyroglobulin is the inactive storage form of thyroid hormone. Now, if you remember last time we talked about thyroxine or T4 and then also triiodothyronine or T3 and how the thyroid gland produces those two hormones and how they get converted from a more pro-hormone or inactive stage into an active stage with that removal of an iodine group. Now, what thyroid peroxidase does when it's in really high amounts is it actually causes a deficiency in the thyroglobulin itself. And therefore, if you don't have the storage form, you can't have any inactive form, and therefore you definitely can't have any active T3. The anti-thyroglobulin antibody, on the other hand, and I know in the last segment I said antigen, it's actually an antibody. That's my mistake for talking. But what that does is it is a representation of the immune response that your body has to that thyroglobulin or that storage form. So obviously, if that antibody is in high amounts, what that means is that the body is attacking that thyroglobulin itself over and over and over again. So both of those are the most common markers of Hashimoto's hypothyroidism or Hashimoto's autoimmune thyroiditis. Now, one of the really interesting things about Hashimoto's is especially that in the early stages of the disease, patients will often have either labs or symptoms that are more hyperthyroid in nature. So they may have more rapid heart rate, inability to gain weight, or they're losing weight a bunch, they're really hot, stuff along those lines. And what's happening is that the antibodies are attacking the thyroid gland itself, and so it's kind of sending out these surges of thyroid hormone. And so after time, though, the thyroid's response gets lessened and lessened, and it really will switch into a fully hypothyroid presentation. So if you ever went to your doctor or your healthcare provider and they ran some tests and said, oh, you're hyperthyroid, but all of your symptoms are more hypothyroid. So the weight gain, dry skin, feeling cold, kind of swelling, edema, all those things, you may just be in really early stages of Hashimoto's. Now, there are a lot of other things that play into autoimmune thyroid disease that, I think it bears worth talking about. We mentioned a little bit last time about things like selenium and talking about iodine supplementation and all those things. But one of the things that we really see is a very important correlation between our gut health and thyroid. A lot of people, especially women that may have some issues with either gluten or other food sensitivities, may have manifestations of those sensitivities as in their thyroid. And there are some authors out there that have done some research that has actually said they've been able to significantly improve the symptoms and the functioning of hypothyroid patients if they go on a more autoimmune type diet. Now, once again, these statements have not been approved by the Food and Drug Administration, yada, yada, yada. But it definitely is really interesting to see that there is a correlation between other parts of our body, and in this case, the thyroid gland specifically. So let's say that your doctor ran the right tests, they drew your TPO or your anti-thyroid, anti-TG antibodies, and lo and behold, they've come back really high. So they say, aha, you have Hashimoto's thyroiditis. What are you gonna do now? The unfortunate knee-jerk reaction for a lot of low thyroid disorders is to give that patient T4 or Synthroid or levothyroxine. Kind of all those things are the same there together. Unfortunately, though, that may not be getting to the real heart of the matter. The problem may not be that the patient, has a deficiency in that pro-hormone state. The problem is that they are not getting the actual active T3 in high enough amounts, so their tissues are responding in a deficient sort of way. So a lot of research actually looks at, instead of going through the T4 regimen, going into something more T3, like a Nature-Throid or Armour Thyroid or something along those lines, and really attacking that deficiency in the thyroid hormone itself. Now, obviously, every patient is different, and you can't just have this kind of, panacea type effect. So some other things that have been shown to improve symptoms include diet, like we talked about a little bit before. Actually, low-dose naltrexone or Narcan has actually been shown to improve thyroid functioning in patients who have Hashimoto's. And the reason behind that, they hypothesize, is that in really low doses, Narcan, which normally we give in the hospital to people who have had opioid overdoses, actually can act as an anti-inflammatory and can actually go in and reduce inflammation and damage in the thyroid, and therefore those patients who have autoimmune thyroid problems may get better. I know last time I mentioned selenium as well as a nutrient or a mineral, that you can use to help with autoimmune symptoms. And really, I just can't stress the importance of trying to reduce overall inflammation in the body. Whether that's through exercise, whether that's, if you're under chronic stress, if you have some degree of insulin resistance, let's say you have polycystic ovarian syndrome with insulin resistance or things along those lines, decreasing that can also have kind of a downhill effect on your thyroid and can help improve thyroid function as well. So that's a, tip of the iceberg kind of approach to Hashimoto's. I mean, obviously you could spend an entire web series talking about this disease. It's so intricate and complex, but I wanted to at least give you a basic understanding of it and just let you know that there are other medications out there besides just going straight to Synthroid. And honestly, for a lot of patients who have Hashimoto's, Synthroid just doesn't really work well. So talk to your provider about that. Look at some of those nutritional changes. Look at possibly increasing the amount of selenium in your diet. If you have other comorbidities that are increasing stress, like insulin resistance, like I talked about, address those, and that should help too. So we're going to move on to another type of thyroid disease that we see, and that's a low thyroid secondary to having your thyroid removed. So a hypothyroid status post-thyroidectomy. So as a whole, thyroid cancer affects around 200,000 people or so in the United States every year, and more women than it does affect men. It usually is caught early on, and therefore fatalities, mortality from the disease is rare, but it definitely can still be fatal if it's left untreated. Early symptoms of thyroid cancer include things like swelling in your throat, a painful thyroid gland, difficulty swallowing, voice changes, kind of things along those lines. And because you're changing the actual metabolic activity of the thyroid, patients who have thyroid cancer may present with either hyper or hypothyroid symptoms. Obviously, if this is something that's concerning to you, I advise you to talk to your healthcare provider about this, because I'm not really going to get too much more into thyroid cancer itself in this video. Now, the mainstay of treatment for thyroid cancer has been removal of the thyroid gland, and that can be either the entire gland or part of the gland, or kind of depending on where it's affected. And obviously that's going to have differing effects on the patient's thyroid function post-surgery. For those that still have some thyroid gland left, they may be able to make enough endogenous thyroid hormone to be fine. For ladies or men who have a total thyroidectomy, though, obviously they're not going to be able to produce any thyroid hormone on their own, and therefore are going to require supplementation. And that's really where the debate kind of comes into play. So if you think about it, if we remove the entire thyroid gland, not only are we removing the body's ability to produce thyroid hormone in any substantial amount, but we're also removing a lot of the storage of the thyroid hormone itself too, in the form of thyroglobulin. So giving patients who have a thyroidectomy T4, in whatever form that may be, will supposedly go in and fix that problem. And for some ladies, that's true. You know, I mean, you're able to metabolize the T4 to T3 in high enough values that they really are back to what's called euthyroid state. Now, there is a hormone produced in your liver called sex hormone binding globulin that acts as a reproductive and endocrine system transport hormone. So basically, it goes around and picks up unbound or free sex hormones. But one of the things that we do know about SHBG is that it will also pick up unbound thyroid hormone too. So if your SHBG is too high, even if you're getting enough T4 to convert it into T3, it may be picking up that unbound hormone to amount that your body is not registering that it's receiving any. Certain things that increase SHBG include birth control pills, probably the #1 thing out there. Now, obviously, insulin resistance can change it, actually drops it, other things like that. But if you have had your thyroid removed and you're on birth control pills, you really want to actually check and see, you know, is that potentially a problem, or could that be affecting your treatment? Okay, so to finish things up, now we'll talk about Graves' disease or hyperthyroidism. You know, so as far as thyroid dysfunction goes, Graves' disease presents as with rapid heartbeat, increased core body temperature, increased metabolic activity, kind of everything that you may have had with hypothyroidism, flip it on its end, and those are the symptoms for Graves. And some of the other things that people kind of commonly associate with it are bulging eyes. And so you may actually see that your eye gets enlarged because there's a colloid deposition behind it. And so you get this condition called exophthalmos, where the eye starts protruding forward. Other things in terms of long-term issues with Graves' disease include things like osteoporosis, heart disease, and some other just issues down the line. So this is a condition you really need to get a hold of. Like I talked about in my last video, you know, two of the main treatments we have for Graves' disease are either PTU or propylthiouracil or methimazole. Now, both of these actually affect the body's ability to make or to produce thyroid hormone, or that conversion from kind of that pro-hormone to active hormone, but they do come with side effects, like I talked about: hair loss, skin changes, teratogenic effects, which are birth defects if a lady takes one of these while she's pregnant, are all things that really have to be discussed with the provider who is prescribing one of those medications. As a gynecologist, if I have a patient who is not actively trying to get pregnant, who has been diagnosed with Graves' disease, I always want to have her on some form of birth control if she's taking either methimazole or propylthiouracil, just because they do have that increased teratogenicity there. The other thing to look at with Graves' disease, even more so than something like Hashimoto's, is that you can go and treat the symptoms quite a bit more effectively. So like I said in my last video, if you have a rapid heart rate, you know, maybe using something like a beta blocker to drop that heart rate down. If you're finding that you're anxious all the time, maybe some sort of anxiolytic to help with those symptoms. So you can address the symptoms themselves of Graves' disease, but overall you really do want to make sure that the body is not getting too much thyroid hormone and causing those long-term bone and cardiac problems like I spoke about. So outside of medications, what are some things that we can do for Graves' disease? Well, selenium, once again, autoimmune thyroid function, there it goes. Something that I have heard patients try that I do want to kind of caution against is using some of the herbal supplements, especially something like ashwagandha. Now, ashwagandha has been used in Ayurvedic medicine for quite a long time and can be beneficial if you look in some of the Ayurvedic literature for ladies or men who have hypothyroidism, which is actually absolutely contraindicated for those people who have hyperthyroidism. So, herbal medications, botanicals, essential oils, all those things, can have a medicinal effect. So you really have to be careful. If you're going to call it herbal medicine, then just like we call, kind of conventional medicine, drugs have possible side effects. Herbs have possible side effects. So you can't just take them willy-nilly and not worry about, any type of negative outcome. So kind of in closing, as far as autoimmune thyroid disease goes, it's very common. And we do a really crappy job testing for it because we don't really look at the hormones that we should be. We're not looking at the T3s and the T4s and the reverse T3s and the thyroid peroxidases, and in the case of Graves, I didn't even talk about it this time, but the thyroid stimulating immunoglobulin. There's just so much to thyroid that you can't just boil it down to drawing a TSH. And unfortunately, as medical professionals, that's what the majority of us are trained to do, or just kind of do in terms of a knee-jerk reaction. So if nothing else from this video, I hope that you take that away. And if you are having any of the symptoms like I talked about, as far as hypo or hyperthyroid, or especially if you've had your thyroid removed, it really behooves you to find a provider that can really delve into this and really look just beyond the labs at your symptoms and kind of address them from a root cause, and who really understands the endocrinology of this all. Other than that, that's it for today. Thank you so much for joining me. I hope that you've enjoyed this video. As always, if you wouldn't mind subscribing to my channel or right there and liking it, hit that little bell and you'll get notified whenever I put new videos. I'm Dr. Corey Babb, and I hope you have a wonderful evening, and I'll see you next time.